Ready to go local live. I'm Josh Fenton, CEO and co-founder. A lot of news here in Rhode Island this morning. Let's check them off the list. First and foremost, Go Local exclusively reported about FBI, Providence, and North Providence Police raiding a number of locations yesterday tied to what is believed to be a major prostitution ring. How large it is and what the implications are unknown, but there were raids in 3 locations, both in Olneyville and in North Providence. GoLocal has that, and I believe is the only news organization to report that. Expect more on that over the next couple days. Also, on the more interesting side, and the good news side, is the city of Providence and the state of Rhode Island have come forward with some funding to make sure water fires continues. GoLocal broke last week that water fires had been cut out of a budget that was intended to give them $300,000 by the city council. The city council reversed course, and those dollars are going forward. Last but not least, and just broken a few minutes ago, an interesting consolidation. Water fires again is bringing over the Wilbury Theater. Wilbury Theater going forward will be operating out of the Water Fire Center. And so an interesting collaboration and consolidation. I think that's a benefit to everybody and keeps both of those great organizations moving forward. Let's go to Dr. Michael Fine. He's the former director of health. Dr. Fine, there is coronavirus news around the world. It's tied to the Delta variant that we've been discussing over the past few weeks. The Delta was originally disseminated from, believed to be India, and wreaked havoc in that country. Now, LA is remasking.
Yeah, and Britain is remasking. There's remasking happening around the world out of an abundance of caution, particularly when the virus, the variant spreads. The British numbers are particularly interesting because it's not just, there's a larger percent Delta. The British numbers are actually showing another small surge. And that's clearly what we need to be concerned about, given that the British are about as vaccinated as we are, though in general with a different vaccine.
So you see these numbers. We've been sharing them back and forth with yourself and Nick, a former pharmaceutical executive who works with us on these numbers. We've been kicking these around for weeks, but more focused in the past couple days. Does this thing hit Rhode Island, and do we close down again in the next few months?
I have no way to know. I worry a bunch about our testing, that our testing is mostly Binax or the rapid test in the highly densely communities that are most at risk. So I worry, I think those are the communities where Delta is going to show up first, and I really worry that we won't see it until it has spread more widely, because we're not testing with PCR and with DNA sequencing. So we may not know if it's here when it gets here.
Please go ahead.
Well, and those are the communities where our vaccination rate is lowest and where we haven't been able to make much progress in increasing that vaccination rate. That's exactly where our vulnerabilities are. And that's what we got to be worried about.
Yeah, we've shared some data from the Department of Health between internally amongst us at GoLocal. There are a number of zip codes, predominantly urban, lower income, that have vaccination rates in the 40 and barely 50% rate. Those are susceptible to that variant getting in there and spreading and having a tremendous impact.
Yeah, I'm now urging organizations to poll their own workers and understand what percent of their workers are vaccinated. You can do this in a voluntary way, and you can do it anonymously. But if you find out that 95% of your workers are vaccinated, I think you can relax a little bit. But if you find out that only a small percent are vaccinated, and that you don't get a lot of response, which probably is a proxy for not vaccinated, then you're the organization that wants to think hardest about continuing to mask. And that's evidence that I think people can start gathering for themselves and should given the presence of the Delta variant in other parts of the world and country.
Dr. Fine, we'll continue to monitor the progression of the Delta variant as it progresses across the country and potentially here in Rhode Island. There are cases here in Rhode Island. We'll red flag it as people, more important people get infected with it. Let's jump over to Eleanor Slater. This has become, not just GoLocal, but I think all the news organizations have been looking at different aspects of the management of Eleanor Slater, its lack of compliance with federal regulations. GoLocal, I think, reported on that, I want to say 2 years ago. Staffing issues, management issues, safety issues, quality issues across the board. This is getting pretty serious. This has gotten pretty serious. The McKee administration says this got dumped in our lap. It's a complete mess. The governor's changing out staff rapidly. Management, medical director, COO, you name it. They're falling like dominoes. Give us from running the Department of Health, what your experience has been, both as director and in other professional interaction with that hospital. Talk about what the role of that hospital is and where you think things went terribly wrong.
Well, first of all, kudos to the governor for sort of grabbing a hold of this and working on it and really working hard on it and being frank and clear. That's very important and highly appreciated. Kudos for bringing in Rick Jarish, who's a good guy. And I think will do great work at BHDDH. This has been a problem for a long time, and it's multifactorial. First, hospitals being run by BHDDH, it's not a normal, sort of department. On the one hand, it's mental and behavioral health. On the other hand, it's hospital administration, and they're not entirely unrelated, but they're very, very different areas of expertise. So I'm not sure we've structured it right within state government. We have real issues when we bring the state's personnel policy to the operation of a healthcare facility. That personnel policy has lots of twists, turns, and complexity. It puts a fair amount of power in the hands of the workers, which in some situations is a good thing, but almost too much so that it's hard to actually run the thing. We have this sort of rolling chaos around how we employ physicians and other clinicians, and this is true at Eleanor Slater. It's true at the ACI, where I was medical director for a year. To a certain extent, it's even true in the Department of Health. We don't have a coherent approach to the employment of physicians. It's not run like a physician practice that most physicians recognize. People don't have the same expectations about salary and benefits. Not that people just need to be paid better, but which they probably do if we're going to attract, sort of highly experienced and highly effective physicians. So they not only need to be paid better, but the structure of the whole thing is kind of nuts. And, we would be way better served on the physician side if the state created what I'll call a firm of physicians in state government, so that we had the ACI physicians whose jobs are really kind of strange because of the needs of security. So the ACI physicians, the Eleanor Slater physicians, the Department of Health physicians, if we put them all in one group, partnered closely with Brown and made Brown in return accept 50% of their medical class as Rhode Island, or Rhode Islanders to be 50% of their medical class, but partnered closely with Brown so that we got a real good academic base. We could do amazing things, but we just let it fester. I worked on this hard 10 years ago and got no place. So kudos to the governor for taking it on.
Yeah, I mean, why not outsource it, whether it's to Brown's Medical School, Warren Alpert Medical School, or to one of the big practices and just say, listen, we're not, state bureaucracies aren't good at many things, and we're clearly not good at hiring and managing physicians, let alone a physician group. Why not outsource it to Coastal or any number of the different larger medical groups that are more than capable of taking on these issues?
Yeah, no, I mean, I think it's sort of intuitively obvious, except it doesn't work in state government where, our human relations rules are arcane and archaic. Um, and my guess is we have the same sorts of problems with nurses and their unions and representatives. Just trying to have what's called command and control. You really need command and control in healthcare institutions. You can't do collective bargaining around every little decision if you're going to be effective at patient care. And we just need to get ourselves in a place where we can do that.
Dr. Fine, I appreciate your comments on Eleanor Slater. Let's jump over to another issue. There's some interesting things going on over at Walmart. We talked about it off camera. Give us a little peek to what that major retailer is doing that may be a bit of a game changer in healthcare.
Yeah, it's really interesting. Walmart is private labeling insulin. So is got a way to supply insulin to its customers using a relationship with one of the big insulin manufacturers, and they think they can do it at about 50%, 40 to 50% less than people are now paying. Flip side, people are now paying an outrageous amount of money for insulin. It's costing like $900 to $1,000 a month for people to have just this life-saving medication. Now, I don't have any hair anyway, but when you think about how the market has messed around with healthcare, you see it exactly in the cost of insulin. And the implications of what Walmart's doing, are crazy making because, on the one hand, it's great that we can lower the cost of insulin, though it's outrageous what the cost of insulin is. On the other hand, what this does effectively is drive all diabetics to Walmart. Is that really a decision we want to make? Once upon a time when there were community pharmacies, I'd be much more outraged. But that basically picks up people from the CVSs and the Walgreens and so forth who are diabetics and moves them over to Walmart if they want to be able to afford it, unless those other guys come up with their sort of a competitive approach. At the end of the day, it's a great thing because if all that works, it will drive down the cost of insulin. But it makes people who have a disease into consumers, not patients. And it makes them have to think about the money first, instead of thinking about what they need to do to improve their lives and really prevent the complications of the disease itself.
Listen, if I'm paying $1,000 or $900 a month for insulin, I know I'm the consumer, the maltreated consumer. Listen, we all have our views on the Walmarts of the world, but this seems to be a little bit of an innovative way to shake up the economics of the industry. And in this case, one of the rare cases in which you see that the consumer could actually benefit and benefit significantly. If you're talking about going from $12,000 to $6,000 a year, you may see CVS and Walgreens have to respond quickly, and potentially not only respond, but drop the price even lower. So an interesting shakeup in the world of healthcare. Dr. Fine, thank you so much. I greatly appreciate you taking the time. As always, for everybody else, stay tuned. It may be late June going into July 4th. It is as busy a news cycle as there is. The General Assembly is still in. Some would say that's still danger zone if they're still in session. We'll stay on top of what the decisions they're making up there, and we'll keep you up to date on everything that's moving forward. Thanks everybody for tuning in. I will make the plea again. If you haven't gotten vaccinated, do. This Delta variant is coming. It's having an effect on different countries. Australia is locking down. England's putting in more restrictions. Los Angeles is putting in restrictions. We've seen it before. We're not immune to it. It could be back in Rhode Island. If you're not vaccinated, you can make the difference. Please get vaccinated. Thanks, everyone.
Josh, you're right. The Delta variant is here. Get yourself and your kids, even if they're your adult kids, get them all vaccinated.